Hi, this is Dr. Scott Blumenthal. Today we're going to be watching surgery for a herniated disc in the cervical spine through an anterior approach with an artificial disc, this particular one, the Mobi-C. Alright, what we're seeing here is a standard opening for cervical disc replacement. They call the incision in Langer's lines. As you can see, it's very bloodless. And it doesn't take more than a few minutes to get to the front of the cervical spine. And you can see not much cutting of tissue either. Things just kind of get out of the way and allows you to put a retractor in. What we see here is marking the disc with a needle, and then we'll bring in X-ray to ensure that we are at the correct level.
All right, Mr. Tim.
This shows us placing the self-retaining retractors, and then hopefully we'll give you a close-up to show you the disc a little bit better. This device is a self-retaining retractor, which is very commonly used, or some iteration of it is very commonly used in anterior cervical surgery. Next thing we'll be doing will be cutting the disc. And this begins the process of removing the disc all the way back to the spinal cord and spinal nerves to ensure that everything is freed up and unpinched. What we'll be putting in now are called distracting or retention pins. And this will allow us to open up the disc even more to clean things out. And although we're showing only a few minutes of the surgery itself averages about 45 minutes to 1 hour for one level disc replacement. This is where we get our parallel distraction, and then we set the pins to hold that distraction. It's a very, very important part of the case. You want this to be done in a very controlled fashion because how you distract ultimately determines how that disc replacement is going to look. and then subsequently how it's going to function. So what we're looking at here these are different angled, what we call curettes. And what curettes do is they remove the remaining disc and cartilage from the bone so that it's simply bone on bone, and allow us to see back to the spinal cord and spinal nerves to make sure that they're completely decompressed. This is a trial to see what size disc we want to use. We've already unpinched all the nerves, we've already taken all the disc out, we've already looked at the spinal canal to make sure there's no other pinching from bone spurs or anything else. And we'll pick a device based upon this. And we've selected a size. And that's the disc that we will be planning to use. We're doing our final preparations on the disc right now.
Come on back.
This particular disc is called the Mobi-C. And it's gently tapped into place. And as we're tapping it back, we're looking on the x-ray to make sure that it goes exactly where it's supposed to go. We advance it basically millimeter by millimeter until it's in its optimum position.
That's fine.
And there's the disc in its final position. Looks really good. We're very pleased with that. And we'll take all our pins and retractors out and close her up. What you can see also, which is surprising to some people, that this type of surgery is very blood free. You can see that there's not even any blood on the drapes. So most people lose more blood from the blood tests they have to take to have surgery or an anesthetic than the whole surgery itself. This is Dr. Scott Blumenthal. You've seen an artificial disc surgery today with the Mobi-C. You can reach us at the Center for Disc Replacement at Texas Back Institute.